Good morning, everyone. Hopefully more people will join us for this first session in the Altogether Better Health 10 Reinvented webinar conference. And this is replacing the physical conference we should have had back in 2020, but obviously COVID put paid to that. So we're delighted to launch the first session. We have Elisabeth Schmidt having two presentations with us this morning, and Basira Lawal also, and we will be having 15 minutes presentation followed by 10 minutes discussion and then 5 minutes getting the next speaker up and ready. So I'll stop sharing mine, and I'd like us to all welcome Elisabeth for the first presentation on Do You Want to Play With Me? A party game as a formative assessment in interprofessional education.
Everyone, I welcome you to my talk about Do You Want to Play With Me? A party game as a formative assessment in interprofessional education. My name is Elisabeth Schmidt. I'm a physiotherapist and a lecturer and a researcher right now at the University of Halle-Wittenberg of the medical faculty. What is the agenda for the next couple of minutes? It's first I will say a few things about the background. I will give you the summary of my works, followed by the findings, by the discussion, and I will finish with a conclusion and the pearl of wisdom, of course. Right. Now let's get started. So at the time I was teaching at the bachelor's program in interprofessional healthcare at the medical faculty of the University of Heidelberg in Germany. And this is a bachelor's program where up to 9 different health professions are learning together and getting their academic degree. I was responsible in teaching the module Health Promotion and Prevention. This is a seminary series with different focuses and different lecturers. It does have focuses like health promotion, with topics like how to stay healthy, with the Ottawa chart, with prevention, with models of health. So, and other topics were like prevention with nutrition and exercise or drug abuse. And we also had social and cultural determinants and introduction into health psychology. We had one big problem that the students had problems to interconnect these different contents of the different lecture topics and the different lecturers. And I wanted to help students to connect this in a better way. So for the final session, I was looking for formative assessment. And why did I do this formative assessment? Well, I wanted to improve the teaching and the learning. So learning for the students, teaching for myself and the other lecturers. I wanted the students to reflect their own level of knowledge and to realize their knowledge gaps. And I also wanted to activate the students and to engage students with all of their senses. I wanted to help to set up a different learning opportunity as students learn in different ways. I wanted students to interconnect with each other and to get into action. And as I said already, I wanted to connect the different themes and topics for the students and that they will be able to realize the connections. And I also wanted them to cross-link their knowledge to the existing knowledge they already had. So based on this is a learning theory of constructivism. What did I do? I was thinking of a formative assessment with contents from all lectures. I wanted to connect the different topics. I wanted to repeat the contents of the series with as many senses as possible. I wanted the students to interact. I wanted the students to have fun. And I also wanted the students to get into a game modus and for the students to stimulate their ambition to participate. And I also wanted them to laugh, to be creative, to learn in different ways and think and cross-link the things. So I invented a formative assessment that was based on a party game. The goal of this party game, of this assessment, is you have to explain, mime, or draw keywords and phrases, and all the others. So you have to explain. I choose the keywords from the complete seminary series, and I wrote the keywords and phrases on different colored cardboards, and the color indicated the action, whether to draw, to mime, or to explain. And the other students had to guess. So there were two teams playing against each other. Teams were about 4 to 6 students. And as the course size was bigger than that, there were more students. I was playing, two groups were playing like 4 teams. We played 25 to 30 minutes. And we had a special mode of scoring. So people, the teams would score if they would guess the keyword correctly, and also if the team who explained or mimed the keyword, if they explained it in a good way, that the others would guess it correctly, and within the time, they had 1 minute of time for each keyword, they would also score. And they could also get help from their teammates in case they would just not know one of the keywords, though they could ask their teammates. Now, I want you to give an idea how this worked. So I drew a couple of phrases, and just guess what these small pictures show, and it's all from the context of health promotion. When you're sitting in front of the screen all by yourself, students would interact and they would just call what they were thinking, so in brainstorming, so that the other students would get some idea. This is meant to be the Ottawa chart with a Canadian flag, or kind of, and some kind of chart. Next is this one from the context of more prevention. Which is one way to show a burnout, like the fire that is extinguished. And the third one is a bit more complicated. It's a longer keyword or a longer phrase. And it shows exercise reduces the risk of cardiovascular disease. So this is just of the trial. You all know how to explain things, but just to get you an idea. I did an evaluation of the assessment because I wanted to know what students think about this. So I did a small minute paper with the second and the third cohort. I was doing this assessment. 37 students returned the minute paper, and this was a return of 100%. So there was only one open question, and it was, what do you want to tell us about the formative assessment, in brackets, the game. I analyzed it thematically, and the main findings, I want to share the main findings with you now. So the first thing and the biggest factor for all of them was the fun factor. Students did say it was great fun, it's a good idea, and it's difficult but amusing. Students also said it's too difficult. Some keywords are impossible to draw or to mime. Students also said that some keywords should be in a different category, as some keywords are hard to draw or to mime. Explaining would be better. But they also realized that it was an assessment. Create an assessment without the stress of an assessment. So after these few findings, I want to share the discussion with you. First thing, there is no statement regarding the content of the seminary series, so as I didn't ask for it. So next time I should add a question for this So also potential student gaps did not become apparent. I'm not quite sure whether students did realize in the heat of the game when they could not explain or mime or draw one of the phrases that maybe they didn't know it or couldn't put it in their own context. So for a conclusion about reaching the learning goals, I should do or it is possible to do a structured observation of the game and then see maybe what phrases are very hard for the students or from what context. So about the cross-linking, well, I think the students did a good job because they were able to explain most of the keywords and phrases, and they also guessed correctly. So they did remember them, they could put it in their context. But I also think that keywords should be tested again and modified if necessary. And so that's one point. But the students did engage in the activity and they were having fun and they were engaging with each other. So it was a great fun factor. Students were laughing, they were acting, they were moving around, which was one part of the hidden agenda. And I think this is also one part of health promotion because the students engaged in this activity and they were laughing, they had a better oxygen intake, they were not sitting in their chairs. So, which I think was a cool thing to do. Now, what is my conclusion? Well, I think a modified party game is suitable as an assessment. Interconnect seminars in a creative and a fun way. I have to stress the creative and fun way. It does facilitate interaction in diverse groups, being it interprofessional groups or other diverse groups. I think it's quite a cool assessment to do even not only at the end of the semester, but also within a lecture. And maybe students could make their own keywords, or not make, but write them on a note and then collect them, and then they can do the miming or whatever like this, just to make a short break from teaching, kind of. The resources invested into developing the modified game will amortize as the game can be used again and again for future cohorts. Of course, first time I did this, it did take a lot of time to develop everything, but then as I could use it again, it was just fine. And now I already want to share you my pearl of wisdom. So unconventional methods can promote active student participation in formative assessment when tailored to match the seminary contents. And I want to share two more quotes from my students. Winner, great fun, please hold on to it. And awesome, can we do that in other modules as well? And I think that says it all. Thank you for listening, and I'm looking forward to the discussion with you.
Thank you, Elisabeth. Very nice, clear presentation.
Virtual conference. And I'll be presenting on the topic Together for Patient Safety, Evaluation of Healthcare Professionals' Perceptions of Safety Culture in Public Health Facilities in Kaduna State, Nigeria. I'm Basira, as I said earlier, and I'm a lecturer in the Department of Clinical Pharmacy in Faculty of Pharmaceutical Sciences in Kaduna State University. I'd like to firstly acknowledge the other members of the research team, Dr. S. Mohammed, Prof. Bibi Maiha, Prof. Aliyu, Dr. Emil Aden, and Dr. UI Idris. And also let me acknowledge my beautiful country, Nigeria. This is a map of Nigeria. Nigeria is the most populous Black nation. It has a population of over 200 million people. And we have about over 300 tribal groups. So it's, as I said, it's a colorful country. And we have a lot of young, vibrant, friendly, energetic people who express their creative talents in various ways. And the arrow here shows Kaduna, where I live and work. And It has many educational institutions, and it's commonly called the Center for Learning. This is the outline of the presentation for today. I'll go through the background, the method, the results, conclusion, and the implications of the patient safety culture research on interprofessional practice. Patient safety has been defined as the absence of preventable harm to a patient during the process of care. And safety culture, which is an aspect of organizational culture, captures attitudes, beliefs, perceptions, and values about safety. And in other words, it could be referred to as the way we do things around here simply. And in Africa, there is insufficient awareness of patient safety, and there's paucity of data. And this little data available shows that there's deficiency of safety culture, which compromises patient safety. Also in Nigeria, there's that gap in literature. And although patient safety is a complex phenomenon and requires a multi-stakeholder approach, and of course, an interprofessional teamwork. So assessment of safety culture is considered as a starting point from which action planning begins and patient safety changes could emerge. As such, the aim of this study was to explore patient safety culture with a particular interest on medication safety in selected public health facilities in Kaduna State, Nigeria. The study was carried out in selected secondary and tertiary healthcare facilities in Kaduna State. And Kaduna State is composed of 3 geopolitical zones, and the major health facility from each zone was selected. For Zone 2, where the state capital resides, we selected the two major health facilities to represent 2 tertiary facilities and 2 secondary healthcare facilities. This study was carried out as a mixed method study. It was a sequential mixed method study in which the phase 1 was a quantitative study, and its participants were selected from the 4 healthcare facilities. The sample size was calculated to be 422, and a multi-stage sampling in which we adopted we allocated sample size based on the population of the healthcare professional groups in the hospitals. And the data collection tool for the phase 1 was the Hospital Survey on Patient Safety Culture. And this survey was developed in the United States and has been used all over the world. It's composed of 42 items that measure 12 composites of patient safety. For the qualitative phase, we sampled 15 participants who had earlier indicated interest in taking part in this phase. And we kept collecting information till a point of saturation was attained. And this information was collected through semi-structured interviews in which we had face-to-face interactions with the participants at a convenient place and time for them. We recorded the interviews after they had given their, after they had accepted to take part in the study. The transcripts and codes were developed, and we merged the findings from the 2 phases and interpreted the findings. This result shows the result from the quantitative phase, in which we had more participants from AB Teaching Hospital is in Ahmed Bello University Teaching Hospital, and most of the participants, there were more nurses participants, and most of the participants had direct contact with patients. And a larger proportion of the participants had spent 1 to 5 years in their working unit. From the 12 dimensions of patient safety assessed in the questionnaire, these dimensions colored in red indicate they had an average positive response below 50%, meaning that they were the dimensions that required the most intervention. Staffing was found to be the least with 34.4%, and actually similar studies in Africa and other places around the world have identified staffing as usually having the least positive response. Interestingly, teamwork within units had the highest average positive response. And in the quantitative phase, teamwork across units showed that it was fair at 66.8%. However, in the qualitative phase, we had participants indicating that they were not really working as a team as they wished they would. So the overall average for the 12 dimensions was calculated to be 55.6%, indicating there is need for improvement. For the qualitative phase, we had an overall overarching theme, and we had 2 subordinate themes of factors affecting patient safety and suggestions for improvement. For the factors affecting patient safety, as the coding was being done for the transcripts, we realized that we could map the sub-themes identified onto an identified framework, which was the Vincent multi-level framework that identified 7 factors, which are the work environment factors, individual healthcare professional factors, team factors, patient factors. So we mapped the 30 sub-themes identified. These are the 30 sub-themes, and we mapped them into the various categories of the Vincent multi-level framework. And here too, we found out that a lot of participants were raising issues about staffing, the infrastructural deficiencies, and also the issues relating to teamwork amongst participants. And also the other subordinate theme was on suggestions for improvement, in which participants provided some suggestions. These fell into 9 sub-themes, and there were suggestions on educational improvements, patient education, attitudinal change amongst healthcare providers, amongst others. So because there were a lot of discussions that were raised from the interviews, I'll just present a few verbatim words from some of the participants, especially as those that relate to teamwork and interprofessional practice. There was one of the participants, as a pharmacist mentioned, the doctors in our hospital, we don't really relate well, and the nurses too. It's like the pharmacy department, we are on our own. And this is something similar that happens a lot in Nigeria, because pharmacists are not really involved in clinical practice in Nigeria, but rather are more in outpatient settings as dispensers. So they do not really interact well with other healthcare professionals. But recently there has been a move for introduction of the Doctor of Pharmacy degree, so that we can have more pharmacists in the wards. And then there were some comments relating to interprofessional, a lot of interprofessional challenges and a lot of strike actions due to different grievances amongst healthcare professionals, which still exist, although we're trying to push for all healthcare professionals to work together as a team. And another doctor mentioned, I wouldn't say we work as a team because there are a lot of lapses and communication gaps, but we try to maintain good relationship. So the last comment here I'll post is a suggestion provided by a doctor, in which he said the pharmacists should be involved. Let's work as a team. They should be there during rounds to give their own input. So it seems a lot of healthcare professionals want to work as a team, but there are no guidelines and policies in place in the hospitals to support these working conditions. In conclusion, the study provided a baseline on patient safety culture in the selected health facilities, and it has identified areas of patient safety culture that are of concern and suggested some ways of improvement. So there are some recommendations on implication to interprofessional education and practice, and these results could be used by stakeholders, policymakers, in developing and implementing, evaluating training initiatives. And since a core component of patient safety culture is teamwork, and it's important to promote and emphasize on need for interprofessional collaboration among the healthcare providers, because here in Nigeria, the educational system is that there is no interprofessional educational system in place in the country. So this is something that needs to be informed, the stakeholders need to be informed about. And there are a lot of multi-professional educational tools which could be included, such as the WHO Patient Safety Curriculum, the multi-professional edition, and other interprofessional curriculum. Introducing interprofessional education and learning early in undergraduate days, and not just for continuing professional development, is important. And thank you so much for listening, and I look forward to the discussion.
Thank you very much, Basira, for another excellent presentation, and the second one of today's sessions. Very informative, and I'm really pleased to see you've got engagement with the WHO documentation, because I think globally a lot of us in different countries forget that the WHO have published some good documents, and their 2010 publication, A Framework for Interprofessional Education, is probably still another, though it's dated, document to look at. And just to share with everyone, Interprofessional.Global policy working group is currently reviewing and looking at updating the WHO framework on interprofessional education. So Farah's got your hand up. Hello, Farah. And hopefully I'm pronouncing it.
Hello, can you hear me?
Yes.
Yes, we can hear you.
Yeah, thank you so much for the organizers for this event. And I'm Dr. Farah from Medina, Kingdom of Saudi Arabia. Thank you very much, Dr. Basira, for your talk and for sharing your results of the study. I just wanted to know that have you had any frequent experiences of this interprofessional education exercises in your university, or not yet?
Okay, yeah, we've not had any experience yet, because as I said earlier, usually each, at least for the students in health sciences, pharmaceutical sciences, nursing, each student group has their lectures individually. There is no experience interprofessional education.
Okay.
It does not exist.
Okay, second question. In your study, have you done any association between the level of the qualification along with their understanding on patient safety? Like, I mean, if doctors are there, were they specialists, consultants, or they were just graduates? So have you done any associations?
Yes, actually there were some associations that were done, but we're not presenting it that far, because the hospital survey and patient safety is a very large questionnaire, and there are a lot of other statistical evaluations that could be done with it. Yes, but I didn't concentrate on that for the purpose of this presentation.
Okay, thank you so much.
You're welcome, thank you.
Thank you. Elizabeth, you have a question.
Yes, thank you, Basira, for this great presentation. Did the participants you were talking to and interviewing, did they came up with solutions how to improve interprofessional cooperation or to improve teamwork? I mean, you said that they did realize that they needed to work in teams, but did they come up with any solutions?
No, they didn't come up exactly with a solution, but they provided recommendations. So we intend to look at these recommendations and see how to explain it back to the managers and see how it could be improved upon. But I believe that should start maybe from the early days. If we can look back at our curriculum, undergraduate curriculum, and see how that can be improved upon, maybe we can have a better teamwork healthcare team. So
you will implement interprofessional education, like with the people that are getting their degrees right now. Will you, as I understand you, will you also do like kind of workshops or whatever for the people that already graduated? Yes, because it's not yet implemented in the country. So we started with a workshop. We designed a little workshop, which we started working after getting the results from this study. We started developing a workshop using the WHO patient safety curriculum, actually. So we're trying to see how we can implement that and then find out how well accepted it is. So we're working on it. Great, I wish you all the best for that. Thank you, you too.
Just would like to make the comment that I think the findings you've presented, if we did those in any other country in the globe, we would probably find similar findings. So globally, it's a bit worrying, isn't it, that some of those things come up, and perhaps there needs to be another global recommendation across interprofessional education and collaborative practice. So Thank you very much for your presentation. Are there any other questions, comments, feedback?
There's nothing in the chat, Richard, but if I could just add that it's great to see how committed your team is in what looks to be a huge hurdle, but it's nice that you're part of this community as well, and I'm sure lots of colleagues would be good resources of knowledge and support for you if you reach out. But it is exciting that it's been identified and you're so committed to doing something, so I applaud you for that.
Thank you very much.
Excellent comment, Alison. I now know why I invited you along to help me today. It's excellent feedback. I have put in the chat box that as we are a bit ahead of time, would people just like a quick 5-minute comfort break before we move on to the final presentation from Elisabeth? You could all raise a hand and then I'll... Yeah, looks as though most... Yeah, okay, let's see everyone in 5 minutes' time then.
I welcome you to my talk about the development and piloting of an interprofessional lecture for students of dentists and allied health professions. I want to introduce myself again for all the people who haven't been there before. So my name is Elisabeth Schmidt. I'm a physiotherapist, a lecturer, and researcher, and I'm now with Luther University Halle-Wittenberg in Germany. What is the structure for the next couple of minutes? It's about the background again. I will tell you the summary of the work. I will share the main findings with you. This will be followed by a discussion, the conclusion, and the pearl of wisdom. So what was the background? You all know that interprofessional collaboration is important for effective patient-centered healthcare and patient safety. But even more important in this context is that oral health is important for the overall health for the whole human body. So improving the oral health and its myofunctionality is a common objective of dentists, of dentistry, nursing, and therapy profession, and also of other professions. So it is a relevant subject to teach IPC, interprofessional collaboration. Germany, and especially in Heidelberg, where this lecture took place, there are no interprofessional lectures in the curriculum of the dentists. So this is why we decided to do something about it. I also have to tell you about a special thing in Germany, as I'm talking about the allied health professions. In Germany, allied health profession is not a bachelor's degree or a university degree, but it is a vocational training. So becoming a nurse, you do 3 years of vocational training, or becoming a physiotherapist. And to give these professions the possibility to also get an academic degree, there is this Bachelor of Interprofessional Healthcare that I was talking about before, and so that the students can do the academic degree. They start parallel to their vocational training, and once they finish this training and get their degree as a nurse, as a physiotherapist, as a speech and language therapist, they start, they continue the bachelor's degree in full time. So, and they are, most of them are working part-time, and they are gaining working experience. This is important for you to understand later on some of the things in this session. All right. So, as there was no IP lecture for the dentists, we decided to develop a student, an IP lecture for the dentistry students and the students of the Interprofessional Healthcare Bachelor. This was developed, piloted, and evaluated. The IPC lecture was embedded in the module Oral Health of Children, and key feature was an interprofessional casework. This one was based on the problem-oriented learning, and the students had to develop an interprofessional treatment plan. They had to do a presentation via a poster, and this was followed by a discussion of the outcomes and also of the work process. So who developed this lecture and the casework involved a dentist who is working in child dentistry, and she's a lecturer at the University of Heidelberg as well, and a physiotherapist with working experience in physiotherapy in different settings, and a lecturer, researcher, and also very experienced in interprofessional education, which is my person. So, but we also got input and needed input from all other involved and or necessary professions like orthodontia and pediatrics, who are not directly involved, and we didn't have any students of these, but we needed that input for the caseworks. Right. So what were the learning goals? Learning goals were students were learning with, from, and about each other, about the involved professions, their competencies and responsibilities concerning oral health. Students were learning how different healthcare professions can help to improve oral health. And students were learning about roles and responsibilities of professions. And the last goal in this context is learning how to communicate within an interprofessional team. So what did this session look like? We started with an input seminary. Contents were IP teamwork and IP communication. And as you can see, so we had these dentists were all sitting next to each other, and allied health professions, the students of interprofessional healthcare were sitting all next to each other, and there was no interaction. We then, after this lecture, after this seminar, we split the big group into smaller teams of about 4 to 6 students, and we try to do the teams as interprofessionally as possible with as many professions as possible. The team started with a small getting to know session in order to get to know the teammates, but also in order to get to know the other professions. After that, they got the actual case, they got an assignment sheet, and they got a patient file that we had tried to do this as realistic as possible. So they had all the information they needed. They had like all the assessments that had the results of all the assessments that had been done. They had the X-rays. They had pictures of the person. They had letters from the involved professions, and they had 60 minutes of time to work on this case, and then they had to design a poster with their outcomes. For the presentation of the outcomes and discussion, we all got together again in one big group, and the students presented their outcomes, and we discussed about it. And on one hand, as I said, about the outcomes, but also about the work process. And one question that arose for the students was, and that was very important for them, we discussed about it quite a lot, how to work interprofessional in a real work on a daily basis and in real life. And as you can see, first the students were being just the dentists and the allied health profession. Actually, during the presentation, they were still mixed up and were in interaction with each other and with the different professions. So what was the case? We had selected a case, a girl, 8 years, called Mira, with trisomy and a very bad oral health status. Mira was in a special school, or is in a special school, and teachers realized that she was eating only very soft things. And they were wondering about that, and then they found out that she was in pain, that her teeth were aching, and she was eating hard things. And they recommended the mother to go to a dentist with her. Why did we collect this case? This case actually is based on a real case, on a real patient. We changed it a bit, of course, but we selected it because you can involve a lot of professions. So due to the bad health, due to the bad teeth, oral health status, of course, you need the dentists. due to the very hypertonus of the whole body. There's a lot to do for physiotherapists, for speech and language therapists, due to the eyesight, for the optometrists, and so on. That was one reason we decided on trisomy. And that was also one important reason, as it was based on a real case. We had a lot of information, so we could use the real letters from the therapists, we could use the real data, which was a great help because it is a lot of work to do a casework like this. So I think I want to continue with the evaluation. Of course, we did an evaluation. We did have to use the standard evaluation tool of the university, but we were able to add some questions. 18 students returned the evaluation, which was 88%. And we did the evaluation at one time, just at the end of the lecture, and right after we finished. And I want to present now the main findings. One of the questions was, I can describe the perspective, possibilities, and approach of the different professions. And we started, before the lecture, students thought they had like a 3, they gave themselves a 3, and after the lecture it was a 2.5. Please recognize that 1 being I strongly agree, and 6 being I strongly disagree, which is the German system of school grades. The next, one of the other questions was, I can reflect the perspective, possibilities, and approach of the professions. Before the lecture, it was a 2.7, and after the lecture, about 2.3. Also, so you can also see that there was a gain of this knowledge and of the possibilities and competencies. The next finding is, which was important for us, within an interprofessional team, I can involve team members in an appropriate way for decisions of treatment. Before the lecture, students thought of themselves as a 2.5, after the lecture of 2.1. So there's also an increase in this competence. We also did have some quantitative questions, and the main findings here are that students did realize the importance of interprofessional cooperation when treating patients. They also say interprofessional cooperation can facilitate and add to one's own work. Students learned most from the casework and the discussion, and especially the discussion was emphasized and stressed by most of the students, so the discussion seemed very important. We also found out with these questions that students wished for more cases because all groups were working with the same case and presenting the same case. And the input seminar was criticized for showing the length and the structure. And I want to say this a few words of one of my students. Interprofessional cooperation is important. Everyone knows his or her own profession and can contribute to the therapy for one patient. Now I want to continue with the discussion. As there were only very few participants, the outcomes have to interpret it with very great care. We say our learning goals were reached, but we had wished for more distinctive results of the evaluation. For students of dentistry, this is the only interprofessional lecture, as I had said before. So this may actually explain the higher benefit for the dentistry students than for the interprofessional healthcare students, who have more lectures on this topic, of course. And we also did an analysis of the evaluation for the both group, for each of the groups. So And it might also explain why the results I presented are not as distinct as we had hoped for. What would we do next time? We would redesign the input lecture, of course, and then we would do the evaluation with an IP tool. We would also try to include the missing professions, like occupational therapists and nutritionists. We would do more than one case if possible. And it's possible to do this with different subjects, a lecture like this in different subjects, like geriatrics, for instance. And what is next for myself, as I changed my place of work, and I'm responsible for the interprofessional work at the University of Martin Luther University. I will design and similar lectures like this, but first I will have to get to know people there and find out who is interested in working and doing interprofessional sessions like this. And then I will decide on a case. So what is the conclusion of this? Is IP lectures are important for students, and especially of dentistry, students of dentistry in this case. These lectures should be included routinely throughout the curriculum, and cases with discussion are an appropriate method to teach IPC. And as I stressed before, when planning an IPE or IPC lecture, think of the professions that are participating and of the participating students, and then choose the case accordingly. And I can recommend you try to choose a case that is based on a real case, as I said. And as it needs a great amount of resources, it does make a lot of sense to implement the lecture to use this over and over again. My goal of this one is developing an IPC case with many human resources, but students gain invaluable knowledge and learn about the importance of IPC and about other professions. And this is important for effective healthcare. Thank you for listening. Oh, this is not a quote from one of my students. Last word, cooperating with other professions is important and can be fun. Thank you for listening.
Thank you very much, Elisabeth, for another excellent and final presentation of this morning's 3 presentations. Your presentation is timely for us in the United Kingdom, as dentistry, the professions engaged with dentistry, such as dental nurses, orthodontists, hygienists, etc., are now beginning to take an interest in interprofessional education and collaborative practice. And I've recently chatted to some dentists and a lead for the General Dental Council in the United Kingdom, who are very keen and positive for the development of interprofessional education and collaborative practice. So your presentation and content has been excellent and timely for us, definitely in the United Kingdom. And I'm really pleased as well to see your excellent engagement of professions that we often miss out when we think of the team. And I think as IPE educators, we need to remember that and think out of the box to make sure we engage with all the professions possible.